early intervention. The right care at the right time. Feeling safe, confident, independent. That's what Lifeline is all about. It's a personal connection to people who care.
Just checking in, Sally.
How are you feeling, Mrs. Brandt?
I've been kind of tired, draggy.
Do you need any help there?
No, it's probably the Procardia.
I have a feeling my dose will have to change. I'll ask my nurse on Thursday.
Other than that, things are good.
Carol's coming up.
Well, that's great.
As the nation's first and largest personal response service, Lifeline has served over 4 million people through more than 2,000 providers throughout North America.
I couldn't be around, and I used to worry all the time, so it's made a tremendous difference. It really has.
It's been nearly 3 years now with Lifeline.
Yeah. In fact, even before we got the service, we gave them all this information on Mom. So now when she calls, the monitor knows exactly who she is and who to call if she needs any help, and it's great. Yeah.
I keep telling Carol, I don't think of them as monitors. I think of them as friends.
With its superior technology and dedicated staff, Lifeline is here to help 24 hours a day, 365 days a year.
Oh, tell them about the time you were locked out.
Oh, I panicked. I locked myself out of the house. The temperature must have been almost 30 degrees.
And so, remember, you pressed the Lifeline?
I pressed the button, and when Jill...
Yeah, that's the monitor.
It didn't get a response from me. She called Helen, and Helen came right over and let me in.
It starts with a personal help button. Lightweight and waterproof, it can be worn on the wrist like a watch or as a pendant. And this button begins the process. Once pressed, it signals the in-home communicator. The communicator then automatically dials Lifeline's response center. Within seconds, voice contact is made with a certified Lifeline monitor, trained in areas such as interpersonal communication, stress management, and gerontology, and who, if necessary, can communicate in the caller's native language.
Je vais téléphoner à votre fille qu'elle vienne tout de suite.
Sí, señora. Ahorita que acabe de hablar con usted, yo le llamo a su hijo, a que vaya a ver qué necesita.
Or access AT&T's language line.
Hello, Mrs. Brandt. This is Bill calling from Memorial Hospital Lifeline. Do you need some help today?
I've slipped, and I'm lying here in my kitchen.
Would you like us to send help?
I just need someone to help me up.
Well, then I'll call your neighbor, Helen Watson, and send her right over.
Oftentimes, a situation requires the help of a nearby neighbor or friend, known as a responder. From the start, the responder agrees to come to the subscriber's home and provide assistance whenever needed.
Hello?
Hello, Mrs. Watson. This is Lifeline. Your neighbor, Margaret Brandt, has taken a fall in her kitchen. She's a little shaken, but says she's all right. She just needs some help getting up.
Oh, dear, I'll go right over.
Okay, you have a key, don't you?
Yes, to her front door.
If it's determined that the caller needs further assistance, the Lifeline monitor sends appropriate help. For instance, the police, fire department, or perhaps an ambulance.
Hello, Mrs. Watson. This is Bill from Lifeline. How is Mrs. Brandt doing?
Oh, she's very uncomfortable. She can't put any pressure on her right hip, and I'm afraid to move her. Maybe you should call an ambulance.
I'll call one right now. When they arrive, Mrs. Watson, could you press the button to signal us again?
Because time is critical with every call, information from the subscriber's Lifeline care plan is stored in Lifeline's powerful computer network and downloaded to the monitor's computer screen. Information such as street address, family members, neighbors, hidden key location, physician, home health agency, hospital preference, emergency services, physical limitations, allergies, and other subscriber information issues.
Ambulance service.
This is Memorial Hospital Lifeline. I have an 82-year-old woman with a history of high blood pressure. She slipped in her kitchen and has injured her hip. I have some allergy information. Would you like that now?
Why don't you give it to me?
She's allergic to ampicillin and codeine.
Okay, and what's the street address?
16 Old Farm Road. I have directions for you. It's off of Greendale. There's a drugstore on the corner. She's in her kitchen, so you may want to go through the back door. Someone will be there to let you in.
We're en route.
Terrific. Thank you.
Yet the monitor's responsibility is not complete until he or she confirms that the subscriber's needs have been met.
Is Mrs. Brandt being transported to Memorial Hospital?
Yes, they're taking her out right now. I'm going to lock up the house, and I'll take care of Whiskers.
Well, thanks for your help, Mrs. Watson. I'll call Mrs. Brandt's daughter, Carol Rossi.
The emergency contact, which is either a relative, close friend, or healthcare worker, is then immediately called and informed of the situation.
Carol Rossi.
Hello, Mrs. Rossi?
Yes?
This is Bill calling from Memorial Hospital Lifeline. Your mom took a bit of a fall in her kitchen.
Is she all right? What happened?
We called for an ambulance. They said she's fine. They just wanted to have her checked over. She's on her way to the emergency room at Memorial Hospital. The phone number there is 513-468-1200. Her neighbor, Helen Watson, came over to help and will look after Whiskers for a while.
Thank you so much for your help. I'm going to call right now. Thank you. Bye-bye.
The process concludes by entering the call as an actual emergency and giving the final outcome. Within seconds, an incident report is generated and automatically faxed to the subscriber's local Lifeline program.
I check in every Monday. The monitors are so pleasant and easy to talk to.
Well, she's got a few favorites.
They all know about Whiskers.
Mom's constant companion.
I tell them I'm okay, talk about my week. I told them about your visit.
You know, they really are very warm, professional people, and they really care about the caller.
Let's face it, if it hadn't been for them, who knows how long I might have been lying on that floor.
Yeah.
Lifeline, an essential part of any care plan. An immediate response service, helping people get the care they need to get better and back home.
Peace of mind.
Absolutely.
Yeah.
That's exactly what it is.
It's a tremendous freedom for both of us.
I've been in this house 35 years, the last 5 alone.
Well, I'm 3 hours away, and I can't be here all the time.
But our friends at Lifeline are always there. Oh, honey, honey.
Would you help me up?
Oh, what are you doing? What is it this time?
I want to go to the kitchen and get some popcorn.
Oh, no, you stay put. I'll do it. You're not supposed to
But
get
I
up.
can do it.
No, I know you want to, but you can't. You're not supposed to. Just stay where you are. I have to go to the door. Stay put. Oh, hello. Come on in.
Hi, I'm Cindy Bird. I'm from the Home Health
Hello,
Agency.
Cindy. I'm glad to know you.
During the initial home visit, a home health nurse assesses a client's home to identify safety risks and demonstrate key safety concepts. This tape will focus on fire safety, outdoor hazards, and safety risks in each room of the home. Medical equipment, supplies, and the disposal of hazardous waste will also be discussed. The home health nurse will make recommendations to the client and caregiver for the resolution of any safety issues within the JCAHO, OSHA, EPA, and any state licensing agency guidelines and regulations.
Cindy, I'd like you to meet my husband, Alan. Alan, this is Cindy.
Oh, hi, Cindy.
Hi, Alan.
Before the home safety assessment, The home health nurse assesses the client using the nursing process to identify patient needs. Cognitive status of the client is ascertained. If the client is incapable of learning and remembering the safety recommendations, then the home health nurse should ensure that the safety recommendations are directed to the caregiver, although the client should be included whenever possible.
Alan, you're doing very well. Are there any things that you're having specific problems with?
Just getting up out of the chair.
All right, well, let's work on that right now. You've got your walker. Always make sure you have your walker nearby when you try to get up and down from a chair. Okay. Scoot up to the edge. This is a pretty low chair, so you're going to have to work hard to get out of it. Ready? Good. Okay. It might be a little easier to find a different chair in this room. I think the chair that you're in looks like it might be easier for him to sit. Okay. Let's go over here and try it. I can see how you're doing with your walker. Okay. Could you move that out of the way a little bit?
Get in the way.
Okay. Yeah, it's important to keep things out of his path that he might bump into and trip over.
Yes, I guess so. You're right.
Okay, get close to the chair before you sit down. Go down. Okay, how's that?
Comfortable.
Good. I think you'll be able to get up and down from that a lot easier and by yourself instead of waiting for someone.
Yes, I think so.
I'd like to go around the house with you to check out the equipment that was delivered and to look at any safety hazards that might exist and see how we can change things to make it a little easier.
Okay.
Oh, I noticed that you have sliding glass doors over there.
Yes,
You have stickers already on them.
Yes, we put those on so no one would bump into the glass doors.
I usually have to inform people about this, but it sounds as if you've already thought out a lot of safety hazards. Oh, I notice you have a beautiful fireplace.
We have a screen there to protect the sparks from flying out.
Do you have it inspected annually?
Once in a while.
Okay, it's important to get a chimney sweep here to do that to avoid the incidence of an accident and a possible fire hazard. I noticed that Alan's leaving his medications here.
Yes, he does. They're handy there. He has to have them close by.
It's easier to remember them when you can see them.
Yes.
The problem with that is that sometimes you have visitors, such as children.
Yes, we do.
Come over, and if they see these, children often think that pills are candy. So it might be better to keep the medications in a more secluded spot. Oh, you see this switch here?
Yes,
Would be more easily seen if you got a lighted switch or iridescent strips to put over it so that it would show up in the dark.
Oh, okay. We'll try to do something about that.
I see a transition area between the rug and the hallway here. There is a little ledge that's developed between the rug and the hallway, and it would be nice to make sure that this isn't a loose rug so that he doesn't trip over it.
Oh, okay. We'll watch that.
Okay, you can trip over that too, so it's important for everyone.
Would you like to see the bedroom? It's right here, right next.
Let me get my checklist. We'll go in.
Okay.
A checklist itemizing fire and safety hazards in the home can be useful for the home health nurse when making home assessments to make sure important hazards aren't overlooked.
Okay. Florence, could you come back here a minute? This hallway is a little bit dim. I would suggest that you change that light bulb and put a little stronger wattage in so that you can get more light, because Alan will need to be able to see as clearly as possible to be safe.
Okay.
And bedrooms?
The bedroom is here, right.
Oh, I see that they've already delivered your equipment.
Yes.
It's great. Were they able to show you how to use it? No. Okay. This is a trapeze. This you'll find very handy for Alan to get in and out of bed.
The home health nurse or therapist should instruct the client and the caregiver in the safe use of medical equipment according to JCAHO standards, and should also check that all such medical equipment is properly installed.
If Alan has a wheelchair or his walker nearby, he can use those for support to help lean upon when he's standing up. So he stands up, and you'll find that it will save a lot of wear and tear on your back to use the trapeze and those other devices. Okay. This is a commode chair. The commode chair has arms that you can put up and down so that he can have some leverage when he gets up and down from the commode chair. This is very convenient, especially late at night, It will keep you from having to walk a long way to go into the bathroom.
Oh, there's the bathroom right here.
So you have a toilet safety frame. Did the vendor show you that it can be adjusted in terms of the height?
No.
Okay. Right here is a little adjustment clip that you just push in, and you can elevate it or lower it. Has your husband been using it?
Yes, he's used that. He hasn't used the tub or shower.
Okay, well, let's take a closer look at the shower and tub and see how they're set up. This is a tub safety rail, and your husband can use this to assist him getting in and out of the bathtub.
What is a chair in the tub for? What does he need that for?
This chair will make it much easier for him to take showers, and it will be a lot safer. A lot of people get tired when they try to shower or bathe, and that's when they have slips and falls.
Oh, and they left this, but they weren't able to fasten it on.
They will be putting this on to the tub spout, and it's a handheld shower so that when Alan is taking his bath, that he can rinse himself off more easily.
Oh, see.
Why don't we bring him in here and we can try to make sure that he knows how to properly transfer.
That's a good idea. Okay.
Make sure you get close to the tub as you can with your walker. Well, you're doing a good job. Good, grab hold of that grab bar. No, you don't want to hold on to that bar there. You want to get hold of the shower chair. That's good. That was good. We put the shower chair here with this handle so you don't grab hold of the soap dish. The soap dish can pull right out of the wall and you'll go falling with it. A lot of times people find that when they use soap, it falls and they have to fish all the way down to the bottom of the tub. One way to keep that from happening is to get a bar of soap, drill a hole in it, and put string around it and put it around your neck. No, you've seen them in the stores called soap and a rope, huh?
Right.
Right, okay. The other thing...
Soap and a rope.
Yep. The other thing that you can do to keep from getting injured is to make sure that the hot water doesn't get too hot. You can look at the temperature on your water heater and keep it at about 111 degrees. That way, no matter if it's accidentally hit and put on full hot water, it won't burn you.
Right.
Make sure when you get in the tub that you use this tub non-skid mat. You have one in here and it looks like a really nice one, so be sure that you keep that in there when you're taking a shower.
Right.
And if you have a rug outside the tub, that's a good idea to keep the water from making the floor slippery, but make sure that that rug doesn't slide. Is your wife at home most of the time?
I can't get her to leave me alone. But of course I need her too.
That's right. You should always make sure that she's within yelling distance when you get into the tub. So if something happens, you can ask her to come in and help if it's necessary. Do you ever use an electric razor?
Yes, I do.
Make sure that you don't use it in the tub.
Of course not. That's dangerous.
Clients may already be aware of home safety issues, and it is important for the home health nurse to respect this.
Florence, did you notice how close that Alan came to this table?
No.
You'll want to make sure that furniture isn't in the paths that he might take to move around the house, either using his wheelchair or with his walker.
Okay.
Also, you want to check to see if the furniture has sharp edges. If it does, it's especially important to put it out of the way so he doesn't move against it and bruise himself or fall over. Okay. Small tables tend to be really shaky. And if you have furniture that's unstable like this, make sure it's not in a place where he's going to want to lean against it for support because he might fall over with the table then.
Okay.
A piece of furniture like this is perfect because it has these rounded corners and he's not going to bump into it and bruise. And it's big and stable and he can lean against it if he wants to without fear of falling over.
Yes.
I see you have a telephone beside the bed.
Yes, I do.
That's very handy. In case of emergencies, you'll be able to call in the middle of the night without having to search for a telephone. I noticed that it doesn't have an auto dial feature.
No, I don't have that.
That would be very handy in case of emergencies, so that you could put in emergency numbers such as the 911 or your neighbor, if you have a neighbor who can help you.
Yes, I do.
Okay. Night light or a bedside light is very handy here. as well as I notice you have a flashlight.
Oh, I have them in various rooms. I have a lot of flashlights, and I have a night light in the bathroom also.
And so you're already well prepared. That'd be very helpful for you and for your husband, for the two of you, to start walking around at night. There's a lot of circuits here on this one outlet.
Oh, is that a problem?
You need to try to limit the number of devices you have into the same outlet to 2 or 3.
Oh, well, I guess I can do that.
Okay. That way you avoid the possibility of circuit overloads as well as electrical fires.
Oh, okay.
And speaking of electrical fires, do you use extension cords throughout the house?
I have a few.
Okay. Make sure that they're rated for the appliance that you're using, and avoid putting them underneath rugs.
Oh, okay.
Because sometimes they can become, if they become frayed, then they can possibly start electrical fires under a rug.
I haven't thought about that. Oh. Oh my goodness. What happened? What happened?
I reached for the popcorn and these things fell down.
Oh dear. Well, back up. Let me pick them up.
But I can do it.
No, you can't. Don't try. Let me do it. Back away.
Okay.
Maybe better go and sit down in the other room, and I'll make the popcorn. I'll bring it to you. Come on.
Okay.
I'm sorry.
Sounds as if both of you are pretty frustrated with things as they are.
Yes, difficult, yes.
Are you concerned about his safety in the kitchen?
Yes, I am.
Perhaps we can do some things to make you feel a little more comfortable for him to work.
What can we do?
What does he like to cook?
Well, he loves making popcorn. He likes to cook. Use the stove.
Okay. The popcorn we can make a lot easier, very easily. One way is, instead of using this heavy glass jar, is to put some popcorn in a smaller plastic container.
Oh.
And instead of putting it away high on a shelf, you can put it on a lower shelf, or you can even put things that he's going to be cooking that day on top of the counter here.
That's a good idea.
That way he won't have to reach in and grab things and search for them.
Yeah, okay.
If you're concerned about him dropping things while he's moving around the kitchen, get a cart. Then you can put things on the cart and he can push them rather than carrying them.
That's an idea. Good idea.
Why don't we go get Alan before we discuss the stove? If he's going to be cooking, it'd be a good idea for him to hear what we're going to say.
Okay.
Alan, go ahead and sit down. Make sure that the chair is behind you before you sit. Good. How does that feel?
Comfortable.
You'll find it a lot safer to sit rather than stand while you cook. Can you reach the stove elements here?
Yeah, but I need my glasses.
Go ahead and put those on. Make sure you leave them on every time you cook. Good. Do you have any tape or any paint
Well,
that
I
we
have
can
some
mark
tape.
these with?
I have some tape to use.
This tape would be good to put on the off switch. That way you'll be able to see very clearly, and Alan can see clearly, the off button to make sure that the stove elements are off when you finish.
Oh, okay, I'll do that.
What kind of things do you like to cook, Alan?
Oh, spaghetti and meatballs, hash brown potatoes.
Do you have a pot that we can try?
Yes.
Okay. Alan, can you put this on the stove for me? Good. See, your sleeve was loose here. When you reached over the stove, it went right over the top of the stove element. You have to be careful not to have loose sleeves, loose clothing, because it's a fire hazard. When you put the pot on the stove, make sure that you turn the handle to the side or toward the back. That way you won't accidentally knock over the pot when you're cooking. Use the front burners rather than the back burners. The front burners get very hot and you have to reach over them. That can also be a fire hazard. I see that you have baking soda here. Do you always keep this here?
Yes, I do.
This is very good to smother fires in case you have an accident here at the stove. Have you ever had a fire at the stove?
Yes.
Okay. Can you think of any other way to put out a fire?
I try to use a lid to smother it.
Okay, that's a very good idea. If it's a small fire, you always want to make sure that you put it out by smothering. Can you move this pot from this burner over to the other part of the stove? Because that's pretty heavy, isn't it?
Yes, it is.
It's also metal. Do you have a pot holder?
Yes.
Okay. It's going to be important for you to use a pot holder to make sure that you don't burn yourself on the handles and things. Okay, move it back here. Okay, that time, instead of lifting the pot, you slid it. Is it easier to do it that way?
Oh, definitely.
Okay, when you try to move pots, especially when they have water in them, try to slide them across the counter all the way over to the sink rather than lift them. And if you've been cooking and the water's hot, wait until it cools down. That way you won't have any spills and possibilities of burns. Okay?
That takes a long time.
Takes a long time, but you're going to find you're going to have to take more time to do things, to do them safely. And it's going to take a little bit more patience than before. If you take your time, you'll avoid accidents, and you'll also save a little bit more energy by slowing down. The next time I come, I'll bring a cart, and we can see how well you can push that with items on top of it. If that's difficult, an alternative is a basket that we can attach directly onto your walker.
In addition to a cart and basket, the home health nurse may also demonstrate small adaptive devices, such as a food processor for clients who are unable to use knives safely, a portable reacher to avoid potentially dangerous bending and reaching, and a medication container that is secure and easy to read. When they finish reviewing adaptive devices, Cindy and Florence will continue their review of the house.
Florence, I noticed that you have a throw rug here.
Yes.
It moves very easily here, especially on this highly waxed floor.
I suppose it does.
You might consider removing it so that Alan doesn't slip or anyone coming in your house doesn't slip when they're in the door.
Well, I need it, though. I have to have that there. It catches all the dirt when people walk in.
Okay, if you really want to keep it, then an option is to get some sticky back tape and put it on the bottom of the rug, making sure you catch all edges, and put it there and hold it down securely.
Oh, okay, I could do that, I'm sure.
Okay. To help as well, you could make sure that you don't wax this floor anymore because Alan's going to be using his walker, and that makes it a lot more slippery.
Okay.
I see you have a smoke detector. I hope you keep the batteries in good working order.
Yes.
You have a double lock system here. I know it's important to have lock on your door, but you also have to be aware that it takes twice as long to get out in case of a fire or an emergency.
No, I hadn't thought about that.
So when Alan and you are inside, perhaps you should only lock one of them, leave the other unlocked so he can get out quickly.
Yeah, we could do that.
Okay. There are stronger locks that you can get rather than just getting this type, so that you feel a little more secure too. It's an option.
We'll see.
Okay, let's go on outside and see what your porch entry is like. You have a nice light out here. Does that come on at night?
Yes.
It's good you have it on an automatic system.
Automatic system.
Let's go on out here.
Cindy has now completed the safety assessment of the interior spaces of Florence and Alan's home. She has reviewed fire safety and has reminded them about overloaded circuits, proper use of extension cords, fireplace safety, and smoke detector maintenance, as well as safe cooking practices. She has noted the layout of their house in order to design a fire and earthquake evacuation plan. She has noted that there are at least 2 exits with clear pathways, and that Alan's bedroom is located near one of them. She has also identified procedures for Florence and Alan to use in case of earthquakes or other natural disasters. In addition, Cindy has made recommendations that will help make the everyday environment safer for Alan. She has advised Florence to remove or relocate wobbly or otherwise unsafe furniture and throw rugs, and not to wax the floors. She has suggested safer storage areas for kitchen items, as well as easier and safer ways of cooking. She has stressed the importance of good lighting, including higher wattage for hallways, automatic porch lights, glow-in-the-dark strips for light switches, and bedside flashlights for emergency use. Cindy has also demonstrated the safest way to use medical equipment and demonstrated the use of adaptive devices. She and Florence will now review the safety of the home's outdoor spaces.
Make sure that Alan is aware of this crack in the sidewalk.
Oh, okay.
You could trip over this and have an accident. If it's not possible to fix it right away, you can paint it with white paint or use some tape if you don't want the paint to be on there permanently.
Good idea.
And over here you have steps leading to the garage. As you can see, they're very uneven, so make sure that Alan doesn't try to walk across here with his walker.
Okay.
It's a very uneven surface.
Yes, it is.
And in your garage, it's important to be careful about fire hazards.
Yeah.
So you should limit the amount of flammables and other items that you keep stored in here.
Okay.
Want to go on back into the house?
Yes. Okay.
It looks like you have a good handle on all the safety changes that we've talked about.
Oh, good. That's fine.
Here's a list of some of the recommendations for some of the changes to make things a little bit more safe.
All right.
I'll be
Thank
back next Tuesday at 11 o'clock.
All right. Fine.
If you have any questions between now and then, don't hesitate to call the office.
All right. I'll remember that.
And write anything down that you think about so we can go over it.
Fine. Okay.
Alan, I see you finally got your popcorn.
Finally.
Good. When I come back next week, I'll bring a basket so we can put it on your walker and see if it'd be easier for you to carry things around.
That should be handy.
Okay. It's nice meeting both of you.
Well, nice meeting you.
And I hope you have a good week and take care.
Thank you.
Okay, bye-bye.
Bye.
The safety risks identified in Florence and Alan's one-story home are relevant to all environments, but the home health nurse must be aware of the special risks associated with multiple-story dwellings. All stairways must be kept clear for quick exits, and no stairway should be without a sturdy, waist-high handrail that extends 18 inches beyond the top and bottom step. If a client is on a second, third, or higher floor, fire safety becomes even more critical. Safety ladders should be installed at windows. There should be a smoke detector in every level of the home, and at least one fire extinguisher per family dwelling. The evacuation plan must be especially thorough. In addition, clients should be advised that in case of fire, they should never use an elevator unless instructed to do so by the fire department. All homes should have a first aid kit, and many families require more extensive medical equipment for the client. The home health nurse must make sure that the clients and caregivers know the proper and safe use of all supplies, medical gases, and drugs, including chemotherapeutic agents. Oxygen cylinders lend their own fire safety issues, and the home health nurse should instruct clients and caregivers accordingly. Explain oxygen safety precautions and make sure through demonstration that the client knows the correct operating procedures and has an equipment information sheet and telephone number for routine emergency situations. Store cylinders away from heat, open flames, and electrical equipment. Post no smoking signs. Check for grounded outlets. Explain the importance of proper cleaning and maintenance, and explain procedures for dealing with power failures. In some situations, there will be hazardous medical waste present in the client's home. The client and caregiver should be instructed in the proper disposal of hazardous waste. Needles and syringes should be disposed of in impermeable containers, and all items that have had contact with bodily fluids, such as needles, gloves, IV bags, and tubing, should be disposed of according to organization policy and applicable state law and federal regulations. There are many dimensions of the home safety assessment, and by being aware of potential hazards, the home health nurse can help to ensure the safety of clients, caregivers, and other household members.
Hi, I'm the nursing supervisor at a home health agency. We're about to follow one of our nurses, Margaret Williams, as she has her initial visit with Mr. William Gersten, a 70-year-old man living with his 67-year-old wife in a two-story house. Mr. Gersten's just come home from the hospital, where he had been admitted 12 days earlier for a fractured left femur. He sustained the fracture when he fell over a high curb attempting to hurry across the street. While in the hospital, Mr. Gersten had an open reduction and internal fixation with a pinning. A few days after the surgery, he developed an infection of the pin at the surgical site. A Groshong central line was inserted and an antibiotic started. Mr. Gersten was placed on cefazolin, 2 grams via the Groshong every 8 hours by CAD pump. He was also given Tylenol with codeine, 1 tablet every 4 hours as needed for pain. After discharge from the hospital, Dr. Robert Green ordered home care services to provide nursing visits to instruct in the use of CAD pump and antibiotic administration, wound care to the surgical site, and skilled observation of the client's condition and response to therapy. He also requested visits of a physical therapist to evaluate and establish a home exercise program and progressive ambulation from walker to cane. Lastly, he wants the nurse to evaluate the need for a home health aide to assist with personal care. While you observe Margaret's interview and assessment of the patient, I'm going to point out how she's able to gather the information needed to answer OASIS questions. In this video, as I mentioned them, we will highlight the 23 OASIS elements that will drive the PPS system and payment for services to your agency.
Mrs. Gersten? Hi, I'm Margaret Williams, the home healthcare nurse from Belcourt.
Oh, hi. I'm so glad to see you, Margaret. I am at my wit's end, and he's only been home for 3 hours.
Oh, well, I'm here to help. Let's hope we can make things easier for you. I have Mr. Gersten's medications right here.
Oh, yes. Come in, please.
May I show you how to place the medication in the refrigerator?
Oh, sure. The kitchen's right this way.
That's it, like that, on a separate shelf.
You know, I'm really not used to taking care of Bill like this. And he hates being so dependent.
I know, really, I can relate. So, can I wash my hands over here?
Oh, of course.
Liquid soap, good. And it's antibacterial, too, that's great. That's real important to have that. Also, it might be a good idea for you to watch me wash my hands. You need to apply a lot of friction to get them really clean. You need to get in between the fingers. You also need to get in the lower wrist area. And when you're rinsing, make sure you just get them cleared off really good. Get rid of all the soap bubbles and everything like that. And I see that you have paper towels there. That's great. That's very important to have whenever somebody from our staff visits. So is this really tough on you guys? Is handling this okay?
Well, it's hard for him.
Yeah.
Yes.
Now, is he upstairs in the bedroom?
Oh, no, that's part of the problem. He can't manage the stairs yet with his walker. And he doesn't want to sleep on the couch tonight. So you're going to find him pretty grouchy.
Well, actually, I do think we have the cure for that. Dr. Green has arranged for the physical therapist to be here later this afternoon.
Oh, good. That'll help.
Here are some OASIS items Margaret has gathered information on up to this point. Structural barriers, MU 310, safety hazards, MU 320, and sanitation hazards, MU 330. As she moves from room to room, she can assess structural barriers, inadequate lighting, and fire and safety. In the kitchen, she may look for cooking facilities and refrigeration appropriate for the home.
Your doctor prescribed, or your money back.
There's nothing on this TV.
Good afternoon, Mr. Gersten.
Vast wasteland.
I'm Margaret Williams from Belcourt Services. How's the leg?
Well, to tell the truth, nurse, it could be better. I'm an active man, and it drives me crazy to be tied down like this.
Oh, now, Bill.
Oh, it's okay, Mrs. Gersten, really. I'd feel the same way if it were me.
Notice that the nurse is actively listening here, facing Mr. Gersten, leaning forward a little, and asking him open-ended questions. In this way, she can complete the OASIS items from MU 560 to 630, neuro-emotional behavioral items that require the use of observation and some gentle probing, or possibly direct questioning to elicit his responses. Through observing the environment, listening to Mrs. Gersten's comments, and taking every opportunity to teach as she establishes trust and open communication with the patient and his family, she can also answer some of the PPS OASIS items. MU 175, prior inpatient facility status within the past 14 days. MU 230 and 240, primary and secondary diagnoses and severity index. MU 250, home IV infusion therapies.
And the surgeon put a rod in the leg, and wouldn't you know, it gets infected.
Well, I have to say, you look very good for all of that. Now, I'm going to take a look at your wound in a moment, but first...
Here comes the bureaucracy, wouldn't you know?
Patience, Mr. Gerson. It's the fastest way to recovery, I promise.
Okay, get my glasses, will you? And I'll turn this TV off.
Now, this is for your sake as well as it is for ours. This is a brochure that shows some of the services that we provide. We have nursing, pharmacy, rehab services. Here are the forms that I'm going to need you to read and sign, or unless, if you prefer, we can have me read them for you.
No, I know how to read.
Okay.
The agreement and consent form for home care products and services may comprise several sections. In addition, Medicare requires Patient Privacy Act information to be given when collecting OASIS information. By terms of the agreement and medical consent, the patient authorizes appropriate treatment under his physician's instructions. He accepts responsibility for the equipment supplied and authorizes the release of medical information and records to appropriate company representatives and insurers. He also authorizes direct payment of insurance benefits to the provider. And finally, he acknowledges financial responsibility for all non-covered items, co-payments, and deductibles.
Oh, are you still in pain, Mr. Gersten?
Oh, you might say that, but only when I move my leg.
On a scale of 1 to 5, with 5 being the most excruciating ever, how would you rate the amount of pain you're experiencing right now?
Oh, maybe 3, 3.5. I haven't had one of those pills since the hospital this morning.
Take advantage of every opportunity to assess and educate.
It's a good idea to take one of these about an hour before we meet. That way, when you exercise, it'll be relatively pain-free.
Okay, let's get this over with.
Okay, where were we? Oh, yes. Patient rights and responsibilities. This covers what you can expect from us as an agency, such as to be treated with dignity and respect.
Well, I hope so.
We also have here a number to call if you need questions answered or if you have any complaints. And if your complaint is not resolved to your satisfaction, there's a hotline number right here to call. Okay? And this also includes your responsibilities as a patient.
Well, like what?
Like you are responsible for remaining under a doctor's service while you're receiving our care.
Yeah, sounds fair. Here, Sally, you check the fine print.
Yes, dear.
And one last thing. Have you heard of the term advance directive before?
Oh, it sounds vaguely familiar. Maybe at the hospital.
Advance directives are a way to spell out very clearly what you want done if you're ever too sick to make important medical decisions.
Kind of like a living will.
Right, that's one way of putting it. It varies from state to state. It directs somebody else to make these kind of important decisions for you in the event that you're unable to. And in this brochure, we have information all about it, as well as phone numbers to call if you have any questions.
You know, she's right, Sally. Can we keep this and talk about it next time?
Sure, good idea, good idea. And if you do decide to generate an advance directive, it's important that you let your health provider have copies, okay? Okay, well, that's it for the signatures. Now it's time to take a look at the real you. I'll be right back. I'm gonna go wash my hands.
After she's introduced the company's services, gained written consent, and informed the patient of his rights and responsibilities, Margaret makes a full assessment of the patient's physical condition. First, with a head-to-toe physical examination.
Aprons? Isn't that a little melodramatic? Not terminally, you know.
It's for your protection as well as mine, Mr. Gersten. With hand washing and using the right protective equipment, we definitely control the spread of infection.
Okay.
Now, I read Dr. Green's wound change order, Mrs. Gersten. Why don't you show me what you were taught at the hospital, and this way I can watch you and make sure we're all using the correct technique.
All right. Well, I try to do it gently, without too much discomfort.
Okay, dip it in there just a little.
Do you think that's enough?
Yeah, that'll be fine. Okay, make sure you gentle.
Right. We want to get it very clean.
Right. But don't want to break apart the stitches. There we go.
Okay.
And
It's sort of awkward.
there we go. Very good. Throw that away. Start with the center first.
Okay. Sticky.
Yep. Excellent job, Mrs. Gersten. You are in good hands. Now, can you handle a few more medical questions before we get down to the fun stuff?
If that's what it takes.
Okay. Any allergies?
No.
Okay. Any hearing problems?
Beg pardon? No.
Okay. Any constipation, diarrhea?
It's not my gut, it's my leg.
Okay. I'm sorry. Doctor's orders. We have to cover all the bases. Now, how's the appetite?
Well, usually pretty good, although I've lost 10 pounds since the accident. You know, my appetite has not been quite so good since the surgery. They weighed me in the hospital this morning, and I only weighed 182.
Okay, well, I think some advice on the nutritional side of things could be helpful, considering you've just had recent surgery and also you have an infection right now. I can arrange to have a dietitian come by within the next couple days.
That might help get me back on the track.
Now, have you been experiencing any difficulty or discomfort when urinating? Like I said, all the bases. Any headaches, dizziness?
No.
I'm almost done here. Let's see. Other than your incision, your skin is in good shape.
I'm pretty thick-skinned.
I might have guessed that.
Since July of 1999, HCFA, the Healthcare Financing Administration, mandates the collection of specific assessment items concerning the patient's demographics, health status, safety, support system, ADLs and IADLs for all Medicare-certified home health agencies. We've always collected this data in a thorough, comprehensive assessment, but now the information is recorded in a uniform way across the country with the specific MO or MU items in the OASIS assessment. The purpose of OASIS is to enable measurement of patient home health care outcomes, defined as a measurable change in the patient's health status between 2 or more points in time. Thus, an OASIS assessment is completed at start of care, 60-day follow-up, transfer to inpatient facility, resumption of care, and discharge or death. All OASIS items are intended to be completed through routine patient assessment approaches and the collection of patients' subjective and objective data. Use a combination of methods: interaction with the patient and family, observation, and measurement. OASIS items are not to be used as an interview tool. Do not read the items to patients asking them to pick the correct answer. Interaction and interview data should be verified through observation and measurement. All of these techniques will be used in conducting an initial OASIS comprehensive assessment. The clinical practitioner can elicit accurate responses by having the patient demonstrate rather than relying on interview alone. People have different perceptions of how they are managing their care versus the clinician's direct observation and assessment of their ability. The different education and training between nursing and the therapies, physical, speech, and occupational therapy, may also result in different perceptions of patient abilities. The specific language of the OASIS items is designed to minimize these differences and standardize the OASIS responses to give greater inter-rater reliability for accurate OASIS data reporting. As reported in the HCFA OASIS manual, completeness and accuracy of OASIS data are imperative. Accurate OASIS data are essential for individual home health agencies to be able to track case mix changes over time, to compare with a national reference sample, and most importantly, to monitor your agency's patient outcomes from year to year and relative to national reference outcomes. Before she started her head-to-toe physical examination of Mr. Gersten, Margaret had been gathering additional data on OASIS items MU 390, vision, MU 420, frequency of pain, MU 430, intractable pain, and MU 780, management of oral medications. In her physical assessment, the nurses gathered information for OASIS items MU 400, hearing, MU 440, skin lesions, MU 445, 450, and 460, pressure ulcer stages, MU 476, stasis ulcer, MU 488, surgical wound, MU 510 to 530, urinary, and MU 540 and 550, bowel ostomy. Assessment of Mr. Gersten's state of mind to answer MU 610, behavioral and mental status items, can be derived from his demeanor and responses. Mr. Gersten, although somewhat anxious over coming home and not being able to get around as he used to, and being confined by an IV, does not exhibit a depressed mood, nor is he belligerent or overly aggressive. Observation plays an important role in the ability to complete the OASIS assessment. You may have to formulate your open-ended questions to elicit the responses you need. You may have to ask the patient straightforward questions to obtain answers, such as in MU 290, high risk factors characterizing the patient with smoking, alcohol, and drug dependency. The assessment of the skin and determining the correct answer to the OASIS question skin lesion MU 440, pressure ulcers MU 450, and surgical wound question MU 482 to 488 are very significant issues for health status, accurate PPS payment, and HHRG classification. Answering MU 440 as yes in combination with a diagnosis of burns or trauma in MU 230 or 240 will increase PPS scoring for reimbursement. They are items that are frequently misunderstood by clinicians answering OASIS. Be sure to consult your agency's HCFA Implementation Manual, Chapter 8, for accurate interpretation of these and other MU items.
Now, your medications. Dr. Green has ordered cefazolin, 2 grams every 8 hours. What other medications are you taking?
Oh, none except for that.
Okay.
Margaret has been collecting OASIS data on oral meds, MU 780, inhalant meds, MU 790, and injectable meds, MU 800. She includes all information relative to the patient's current medications in her admission assessment, and then takes care to ensure that the patient and caregiver fully understand the reason for taking each medication, its possible side effects, as well as possible interactions with other drugs or with food. The OASIS item MU 780, oral meds, will need further investigation as to Mr. Gersten's current level of functioning. Was he able to take his own meds, or does he rely on Mrs. Gersten to take his meds? The nurse may need to review more fully or ask more questions.
So that's the antibiotic and the Tylenol with codeine, right?
That's right. Okay. I tell you, Margaret, taking that IV drug is the worst. The pain I can take. But the doctor told me I'd be taking that IV drug for 3 to 5 weeks. That's over a month of being tied to that pole.
Now, what if I told you, Mr. Gersten, you didn't have to be tied to that dreaded IV pole anymore?
I'd feel great. You mean I don't have to be hooked up to that metal tree?
Nope, there's another way, and I'll show you a little bit later. But first, I need to watch you take a little stroll. Now, according to the hospital report, it says that you're walking with minimal assistance.
Right, nurse. But I think I'm ready for no assistance.
Oh, whoa, Mr. Gersten. You need to learn to take it easier. First of all, when you're coming from a lying down position, you need to first sit up, make sure it feels okay, and then move into the standing position. And you also need to make sure that the walker is in position. Mrs. Gersten, would you be our assistant again and grab the walker for us? And I'll move this table out of the way.
Here we go.
Great. You two work very well together.
Listen, I'm ready for it, nurse. Let me tell you, I used to walk 3 miles a day before this happened. Never turned a hair. I miss it.
The activities of daily living, or ADLs, and instrumental activities of daily living, or IADLs, MU 640 through MU 820, that Margaret has been gathering data on are very important parts of the 23 PPS OASIS items. Based strictly on what you see in this video, there can be differences of interpretation. These differences in Home Health Resource Group, or HHRG scores, will affect PPS reimbursement. Patients sometimes overestimate what they can do. Clinicians should observe and have patients demonstrate what they can actually do, such as need for assistance when getting up from the sofa and transferring, walking, bathing, or dressing, in order to answer these questions accurately. Nurses and therapists have different skills and focus in assessment. To bridge this interdisciplinary gap, have the patient demonstrate ADL abilities and be sure to answer each ADL-IADL question according to the patient's ability to perform the specific activity in his or her own environment on the day of the assessment. The patient's willingness to perform is not the issue. Remember, all scales start from the most independent level, then proceed to the most dependent. Prior status, 14 days exactly, is only described on a start of care or resumption of care assessment. Some of the critical items Margaret has been collecting data on here include grooming, MU 640, dressing upper body, MU 650, dressing lower body, MU 660, bathing, MU 670, toileting, MU 680, transferring, MU 690, and ambulation locomotion, MU 700. Margaret has been assessing Mr. Gerston's ability 14 days prior to today's visit and his ability on this visit. As new clinicians learning OASIS, or as seasoned clinicians using OASIS for the first time, it's important that you read each item carefully, word for word, and select the best answer. 15 years of research with home health patients has gone into the formulation of these responses. Select for accuracy in outcomes measurements. Again, the OASIS manual will provide further instructions on these critical issues.
Great, Mr. Gerston. Now, while you are recuperating from that, I'm going to go with Mrs. Gerston and check around the house.
Make sure the place is fit to live in.
Now, Mr. Gerston. I like what I've seen so far, but sometimes there are hazards around a house that maybe a well person wouldn't be able to notice. So I'm going to check around, and maybe I'm be able to give Mrs. Gerston some ideas that make it easier for you around here. So, Mrs. Gerston, can you take me on a little tour?
I certainly can.
Okay. I imagine Mr. Gerston will need some assistance in bathing to start out with.
Well, you know, I've been wondering about that. He's a pretty big man, and, well, I'm just not so strong as I used to be.
Well, we'll be able to get a home health aide to come by and help assist you with that.
Good.
Okay. So does your husband usually spend a lot of time here cooking, cleaning, that sort of thing?
Not cleaning, but he does love to cook, and he's really pretty good at it. I suppose that's one of the things he's going to have to give up.
Oh, no, don't count on that. I mean, the whole idea behind this is to get back to normal as soon as possible. In fact, the less this thing gets in his way, the quicker he's going to be recovering. But I will say one thing, though. Until he's able to walk on his own without a walker or crutches, it's probably a good idea if you move this area rug, because it's something that he could possibly trip over.
You know, I never thought about that.
Yeah.
Tell you what, I'm going to get rid of it right now.
You know, it's just one of those things that we don't think of very often. I mean, it's kind of like emergencies. Have you and your husband given any thought to emergency preparedness?
Oh, heavens, yes. You'd have to be crazy not to after the last earthquake. We have flashlights and batteries in every room in the house, and radios. And we keep a fresh supply of bottled water and dry goods. I'd say we're pretty well prepared.
Great. In the packet I brought, there's more information that covers what to do if we're unable to reach you or you're unable to reach us in case of some sort of disaster. Now, what about you? Do you have someone to help you out?
Mm-hmm. Yeah. Bill's sister lives just a few miles away, so I'm really pretty well covered. But thanks for the thought.
Oh, you're welcome. All right.
Well, do we pass inspection, nurse? No snakes? No alligators?
Nothing so dramatic, Mr. Gersten. But I was able to give Mrs. Gersten a few tips to help around the house. Basically, mostly things like loose throw rugs and, you know, phone cords that have gone astray. You know, we don't want you tripping on anything. Now, I also have a brochure here that provides a little more information about it and help you to discover some things you may have not thought about. So, Mr. Gersten, have you recovered from your walk?
Oh, I tell you, I was wiped out after that grand tour of the living room. But no pain, though.
Good, good. Now, when I was looking in the bathroom cabinets, I noticed that you had some Valium in there.
Oh, that was years ago. Some business stress.
Last year. That was last year.
It couldn't have been.
Oh, you lose all track of time.
Well, are you taking them right now?
Oh, heavens, no. I can't stand that stuff.
Well, then I should probably tell you that you need to throw those out.
Okay. Will you do that, Sally?
Yes, dear.
Margaret checks through her list to be sure that the essentials of her initial assessment are completed. These include a head-to-toe physical examination, a functional assessment, a psychosocial evaluation, including the patient's and the caregiver's attitudes to therapy, their level of knowledge and responsiveness to instruction, and an evaluation of the home environment for potential challenges or hazards particular to the patient. Information on these issues will allow her to complete all OASIS items on the start of care assessment. Again, although you want all OASIS items to be accurate, the key items for PPS case mix classification that you want to have correct on your OASIS document are the 23 relating to payment, and they are MU 175, prior status related to an inpatient facility. In other words, was the patient discharged during the past 14 days from a hospital, rehab center, a nursing home, or skilled nursing facility? MU 230, primary diagnosis and severity index. MU 240, secondary diagnosis and severity index. MU 250, IV, infusion, parenteral, or enteral home therapies. MU 390, vision. MU 420, pain frequency. MU 440, skin lesions. MU 450, current number of pressure ulcers. MU 460, current pressure ulcer stage. MU 476, stasis ulcer status. MU 488, surgical wound status. MU 490, dyspnea, shortness of breath. MU 530, urinary incontinence. MU 540, bowel incontinence. MU 550, bowel ostomy. MU 610, behavioral. MU 650 and 660, dressing upper and lower body. MU 670, bathing. MU 680, toileting. MU 690, transferring. MU 700, ambulation locomotion. And MU 825, prediction of therapy need, PT, OT, ST. And remember, regarding MU 230 and 240, primary and secondary diagnosis and severity index, the primary and secondary diagnoses should reflect the services provided as well as the frequency of visits. PPS reimbursement includes some secondary diagnoses as well as the primary diagnosis. In addition, a diagnosis of burns or trauma plus MU 440 indicating a wound is present will increase PPS scoring. Correct coding of diagnoses is critical for appropriate PPS reimbursement. Having determined her patient's strengths and needs, Margaret's next task is to develop a treatment plan with the input of the patient and caregiver.
Okay, well, I don't see anything too complicated here. The three of us just need to agree on the best way to have our agency help you get better.
Amen to that.
Okay. Let me give you a rundown of what I think so far, Mr. Gersten. And no, I haven't forgotten about the antibiotic. I just like to save the best for last. Do you mind if we cover the other things first?
Nope. Let's have at it.
Okay. First, the various services. You're both willing and able people, and you did a wonderful job with that wound change. So from a nursing standpoint, I believe that an RN, usually me, should visit every other day for about a week, and then twice a week for 2 weeks. And then we'll gradually decrease it depending on, your progress and your ability to get the skills.
So, you think I can handle it?
Oh, absolutely. And don't worry, this isn't something that you have to get immediately. It's a gradual process. It's ongoing, and we're in it for the long haul.
We'll do whatever we have to do. I sure as heck don't want to go back to that hospital unless I'm really sick. And don't worry, I'll supervise Sally. I want to be sure she doesn't do me in.
Oh. During these visits, we'll teach and monitor your infusion-related skills, check on the progress of the wound, and also, of course, observe you graduate from walker to crutches to cane to nothing at all. Okay, I also believe that Mr. Gersten will need the help of a health aide at least once a week to help with the bathing. And Mr. Gersten, we've already arranged for a physical therapist to be here to assist you with your ambulation process.
Oh, the old ambulation processes. Question. Am I stuck in the walker downstairs until I'm ready for crutches?
Absolutely not. In fact, when the physical therapist gets here, he's going to show you how to use your walker to go up the stairs. Also, I will have him look at the bathroom and see if he recommends a tub transfer seat so that you can swing over into the bath when that time comes.
Terrific.
And there is no need for occupational therapy.
Oh, you mean no knitting, no basket waving?
Now. That has actually improved a lot of patients' lives. Okay, we also have a nutritionist coming, and she'll have you in dietary shape in no time.
Margaret provided Mr. and Mrs. Gersten with a summary of services and a review of the plan of care. The interdisciplinary collaboration and need to determine the need for 10 visits or more of therapy, combined physical, speech, and occupational therapy, is critical to a correct HHRG score for PPS reimbursement.
Okay, so there's you, the exercise guy, the bath person, the diet lady. I'm ready for the fun stuff. What about the antibiotic?
Okay, Mr. Gersten, you have been very patient, so let me show you what I brought. Okay. Unzip it here. Ta-da!
That looks like there's a drug in there somewhere.
Exactly. Actually, there's 2 days' worth of drugs. Okay, now this is the ambulatory infusion pump, and it lives in this neat little pouch here.
And I carry it around like that? No pole?
Yes. And it also has a strap, which can be worn around your waist or your shoulders or around your neck.
That's all there is? That's a miracle.
I thought you'd like it. Now, see, we have on the digital readout, the pharmacist has already programmed it. And the pump will function according to the instructions entered. In your case, remember, every 8 hours. See, you press this stop-start button and you hold it until the dashes go away.
Oh.
See?
Mm-hmm.
Yeah. Now, let me show you both the label because it's very important that you check it before infusing it. And this applies to all medications that you take, by the way. Okay, make sure that it says your name, your physician's name, the correct drug and dose, instructions, and the expiration date. And if you see an expiration date that's overdue, don't use the drug. Just throw it out or call the pharmacy.
That's a lot to remember for an old geezer.
I'm sure you'll manage. For today, I'll set everything up and teach as I go. And over the next week, I'll have you, Mrs. Gersten, take on 1 or more steps at a time. And pretty soon, you'll be able to do all of this without any of us around.
I'm the one with the computer savvy, so you better teach that to me. You look on, though, Sally.
All right.
This'll be a piece of cake, Sally.
Great. Let's get you familiar with the IV supplies and get you hooked up.
I think I'll put the sharps container up here. Our neighbor's son adores Bill, and he'll probably be over every day, so just to be on the safe side.
Perfect.
In her initial visit to the Gerstens, Margaret obtained Mr. Gersten's medical history and learned the specifics of his injury and hospitalization. She completed the OASIS items and continued the process of defining the HHRG case mix classification for this patient, which will determine Medicare PPS reimbursement. She will still finalize plans with therapy as the patient's needs require. The nurse must have this data completed, entered, and locked in the agency's computer system so that orders can be sent to the physician for signature and a bill generated for PPS payment. She has addressed the patient's current physical status, evaluated the psychosocial and home environment, and identified their strengths and the problems to be addressed. She provided information and observed return demonstrations. In defining several goals of therapy, she also initiated an overall plan for their achievement, addressing appropriate referrals to other professionals, and educating about medication side effects and infusion regimen, wound care, and supply and equipment management. In carrying this out, she involved the patient and caregiver every step of the way. She consulted her calendar to suggest a schedule for further visits.
Okay, let's see. I'll plan to be here in 2 days between noon and 2, if that's okay with you.
Well, we can reach you, though, if we have any problems or questions. That's what it says in your brochure.
Absolutely. In fact, that's what I meant by as needed. Our agency has a 24-hour pharmacist and also an IV nurse available, okay, in case there's some sort of emergency. I definitely think that's enough for today, don't you?
I think so.
Okay.
I'm overwhelmed.
Now remember, Belcour's number here is on the front of the packet, and also we have a magnet that you can put on the refrigerator. And if there's any kind of emergency, you can call your emergency service team in this area. I think you guys have 911. Now, may I wash up one last time?
Oh, yes.
Okay, great. I'll even put that magnet on the refrigerator for you. Okay, Mr. Gersten, take it easy tonight. Your doses will infuse without you having to do a thing, and I have every confidence that you'll be getting around in no time. Okay.
So long. Thanks.
Thank you so much. You've been very helpful. You know, I feel so much better now than I did when you walked through that door.
Well, you're very welcome. So I'll give you a call tomorrow, and I'll be back the day after. All right, bye-bye.
Bye.
Thanks again.
That wasn't so terrible, was it, dear?
I guess, but I hate that paperwork.
Well, she had to be thorough, though. I thought she handled it all very well. And you old grouch.
Well, she did cover all the bases. And it's great to have this whatchamacallit. You know, I'm going to be ambulatory in no time.
Right. And I tell you, I really appreciated all those safety tips and good, straight information on the medical front.
Yeah.
And I'm so glad she's going to let me learn it at my own rate. You know, Margaret's a good teacher. I liked her. And I could tell you did.
Well, she wasn't condescending. And she could take a joke. You know, you're right as usual, Sally. She was very clear and very straight with us. She's okay. You know, we're going to get through this thing intact.